Hello? Hello? Hello?
Oh, here now.
Oh, this one there's no turn it on. Maybe I need to turn this on. Because last a couple of times they didn't, the video don't have sound.
Oh no. Okay.
Just test it. This one there's no. Turn it on. Maybe I need to turn this on. Oh yeah. Because last a couple of times they didn't. Okay. Let's talk about starting from the microsurgery, microscope. Let's talk to the. Hello, everyone. Today is April 10, 2025. Today, this is Weifeng from University of Wisconsin-Madison. Today, we have a PGY 1 student from plastic surgery, Kensie. Yeah, we spent 2 hours for the microsurgery introduction. Actually, Kensie has spent one session when she was rotated in here, and yeah, we talk about microscope, suture, and instruments. So today we go over it and see how far we can go. Yeah. So Kensie, tell us about a little bit about you.
About me, wow.
Yeah.
Okay, so yes, I'm a PGY 1 here in Madison at University of Wisconsin. I am originally from California. I went to med school at Quinnipiac. Now I'm here. I'm really excited to try the micro. In terms of my experience, it's really been essentially grounded here. Mostly when I did my sub-I, like we mentioned, and then the microsurgery course, I think some months ago. So now I'm ready to kind of see how far I can take it, like we said.
Yeah. Yeah. So Kensie now PGY 1, she's rotating in general surgery, and today is the transplant. And transplant is also to vessel and osmosis, but the vessel is big.
Oh, yeah.
At least like finger size. Finger size.
Different, yeah.
So okay, let's talk about the microscope first. So the face can. Holding the microphone. Okay. So this is a microscope. It's from science. It's a senior microscope. But how to use it is the same. Mostly the common part is like the eyepiece and objective lens, and then the foot control. Foot control. So here, and Kensie, this one is the eyepiece.
Okay.
And this one is very common to adjust the interpupil distance.
Okay.
So when you're wearing glasses, you may know your number. My number is like 67, 68.
Okay.
So usually I just turn it to match my eye.
Okay.
Here's a number. So just turn, and then you can test. When it matches your eye, that means both of your eye can see one film.
Okay.
Yeah. And this eyepiece can go up and down. So mostly we want to sit straight and then look forward. So this posture can help us maintaining a good posture can help us reduce the fatigue, because the microsurgery usually we will need to do 4 or 5 hours.
Yeah.
Yeah. And here's and then here there's some, you can see there's negative and minor. This one is to change, like we can turn this one and turn this one. This one is adjusted the diopter of the lens. So when we turn into this one, this lens will become nearsighted glasses. And when we turn to the this side, this microscope will turn into a far-sighted glasses, like for the senior people. So one mark, one space here is kind of 5.5. So for me, I almost have 100, like this one, nearsighted like this. So I need to turn to use this one to correct my eye. So only by correcting my eye, so we can see the same focus level on both with you. Like if I didn't put it to match my eye, and then when I set up the microscope, I can see clear. But on the other side, they didn't.
I see.
Yeah. So if you already wear the glasses, and then that means you don't need to. You can put it in a neutral position. Think about if you wearing a wrong glasses, you cannot read and not mention doing microsurgery. Yeah. So this is really important. Yeah. And another use of this one is when you come into the surgery, the operating room, and then our teacher already doing micro, and that means he can see clear. And then you sit down, and then you set it up to match your eye, but you cannot see clear actually. So at that time, you can just adjust this one and to correct the difference between you and your teacher. So you don't need to interrupt your teacher to kind of reset up the microscope. Why that happened? There's 2 reasons. One is that maybe your teacher didn't set it up like match his eyes.
I see.
That's one of them. And the second thing is like there may be something wrong with the microscope. Or like me, our eye change. Like in the morning, my eye is better. So it's like here, and then like one. And then at the afternoon, after I watch the computer for a long time, and then it will getting worse. But I don't know. I still use this one. So there will be some small difference. So this one is very helpful for us to correct the difference of each side. Yeah. But we should still know this one. So we should set up the microscope as close as we can to match our eyes. Yeah, so that's really important. Yeah, and then here's you can see the magnification here. Now it's at 0.4. And when it goes all the way up this microscope, you can step on the. Okay, let's work on this part first. Okay. Yeah. Try to adjust it. Now you may not can see clear because we haven't adjusted the focus yet.
Yeah.
We can just try to see to make it match your eye first. Yeah. Can you see one? Can both of your eyes see one film?
Yeah, a little bit. Okay, there.
Yeah.
And
Don't address that one.
Not
That one,
yet?
I mean, now you're wearing glasses. That you should put it in a neutral position.
Okay.
Okay. And then like stand up and look at my. Yeah, stand up and take a look up here. See, look at the back of the remote control.
Mm-hmm.
See, there's a live spot there.
Mm-hmm.
Like when I getting in this distance, this live spot is very clear and sharp.
Mm-hmm.
Like when I getting moving forward, further, it become blur and bigger.
Mm-hmm.
When I move closer, and it also become blur. So think about that. The light catch film from here and then project all the way to the cones. There's a light cone like this one. It's all focused on this spot, and we would like to put our eyes like in this distance.
Okay.
So only in this distance can allow all the lights enter our pupil.
Oh.
So it's about like 2 centimeters away from there. So at the beginning, I don't know actually. I lean my eyes all the way on here and making there's a circle after the surgery on my eye.
Okay.
Yeah.
So you more like so if I was wearing glasses, for example,
Yeah.
it shouldn't touch my glasses, but be a little.
Yes, almost touch your glasses. It's kind of that almost 2 centimeters away from there.
Okay.
Okay, now you sit down.
Like this. Okay.
Yeah.
Yeah.
How much of your, I mean, the nearsighted, how many degree of?
I think this one is like 3.5 and this one's
3.5.
4.5, so kind of
Oh, that's,
pretty bad.
yeah. The textbook said when it's more than 1.5, you should wearing glasses. Because when, if you remove your glasses, when you move out, you cannot see the table clear.
No, not at all.
Yeah. If less than 1.5, you can use the microscope and leave your glasses on the table. Because less than 1.5, you still can see. Because like me, I still can see the table and without problem. Yeah. Okay, now you try. I stay away. Look at the lens. You can see 2 light spots in there, right? Now you move your head slowly close to the, and your eye keep watching that light spot. And moving forward, closer. Yeah. And tell me what happened.
Like the closer I get, the circles converge and like the image becomes.
Yeah. So this is the one of the method I teach the student. Sometimes, at the beginning they may not understand what they didn't make sense. What is 2 eye see 1 feel?
Yeah.
So by doing this, by doing this, it's a process when they really can see 2 view and converge to 1. So this is a good teaching method. If when you are teaching your student, they at the beginning they didn't make sense of that, you can use this method.
Yeah.
Okay. Now we can see as the try the magnification. Now the foot control. Take a look at the foot control.
Also,
Yes. There's foot control on the left is the zoom in and zoom out. And then the foot control on the right is the focus.
Okay.
Yeah, the focus. Yeah. So you can step on the zoom in and zoom out and see what happens. Left foot. Yeah. You can use your toe to step the distal side and use your heel to step on the other side. It's easier.
Oh, okay. I see.
Yeah.
So heel back. Oh, I see.
Yeah.
Okay.
Keep going. Yeah, keep going all the way. This window shows the magnification. Now it's going up all the way. Yeah. So now it's 2.4. At the beginning it's 0.4.
Yeah.
And look at here. here, the lens
Oh.
outside. Here's 10.
Oh.
10 times. Now 10 times and multiplied by 2.4. Now it's 24 times magnification.
Oh, wow.
Yeah, so the lowest is 0.4. The lowest is 4, like some of the roots. Yeah, can reach 4. And now it's 24. 24 is pretty high.
Yeah.
Okay, that's it. Microscope.
Typically, like the typical magnification for a normal, like a deep, for example.
Deep 4.5 or 5 is good because the deep normally the size of the IMA is about 2.5 to 3 Newton. Okay, I'll zoom out to the lowest.
Okay.
At the 4.
It's at 4.
Now it's off at 4. Okay. And now step on the focus. Yeah, you can step on the focus.
Okay.
This side. Yep. So step on the other side. Then take a look up here. So here's an indicator like when this bar matches this point, that's in the neutral position. We want a microscope at the neutral position so we can adjust it up and down. Like in this microscope is when we step on the focus, it moves the whole head piece. In the microscope in OR, it didn't move.
Oh.
That's the internal motor. They change the lens inside. Yeah, so you don't see this indicator, but we still want the focus in the middle.
Yeah.
So we can see go up and down. So when you, if in that situation, sometimes I use this method. I press the focus going down all the way, and then I press it going up, and then I started counting like 1, 2, 3, 4, 5, 6, or 7, and then I press it going down again, and 1, 2, 3, and then I stop. That means it's almost in the middle, and then I starting to set up the microscope.
I see. Okay.
Yeah, yeah. In some of the microscope, it's like that. And some of the microscope, when you putting the microscope, their working distance is like 200 to 600 centimeter. And then when you set up a microscope in a certain height, and then you can press the focus. The range is pretty wide. The range. So some of the microscope they have indicator in the field, like two red spot, and then when you focus, and then they merge together. That means in a good focus. Yeah, that's kind of a higher. That feature is pretty good.
Yeah.
This one is basically we can understand it, visually understand what's
like
the
how
focus.
It works. Yeah.
Yeah. Okay. Now as we now you can take a look at the microscope. Now here it's pretty clear, right?
Yeah.
So now, but when it's on this mat, it's not so clear.
Right.
So in this situation, at the beginning we want to go to a rough focus by moving the whole microscope. Whole microscope. So this one we can release the nut and then lower it a little bit. Yeah, is that good for you?
Yeah, I see it a little better now.
Yeah. And then we lock the microscope. In the OR microscope, there's a button on the handle. Once you press it, every joint will release, and then you can move it freely. That's electronic magnetic mechanism is very cool. And then you move for a rough focus. Because sometimes this 5 focus, there's only limit, like there's only 1 inch movement.
Right.
So when you want to go to a rough focus, sometimes you need to move a lot. So you need, at the beginning, we should kind of move the whole microscope. That's easier. And then we use this focus, use the foot control for fine adjustment. Yeah. So yeah, you can see here, right? Yeah, pretty clear. This is the needle holder.
Okay.
Needle holder. Okay. Yeah, that's the microscope. Let me. Now this is 4x magnification. Yeah, you can adjust it, the microscope. Yeah, you can think it about like a toy, not an instrument.
Okay.
Yeah, just play with it.
So
No worry. It's
I
solid, it won't
I know.
damage.
I don't think I can break this.
Yeah. Your paper. Now, now we would like to talk about the microscope view and the depth. Now, what's the diameter of the ruler we can see?
I see from, I think it's like 60 to, okay, it's
Yeah.
up to 60.
Yeah, okay, write down. Yeah, now it's 4 times magnification.
Okay, so that means I go,
Yeah,
I zoom in.
yeah, no problem. Just roughly like 60.
Oh, just do
yeah.
the math. Okay.
Yeah, and then let's take a look at the depth. Now,
That is, I'd say also 60, about roughly 60 or.
now for the depth, we want to like the depth. The good depth is we can see very clear.
Oh,
Like here it's about like go to here. That's almost there.
okay.
Yeah, beyond that is blur. We don't want to do microsurgery in here.
True.
So it's about like
Yeah, up to like 20.
yeah, up to 20.
For the depth.
Yeah, the depth. Yeah. Okay, now let's step on the zoom in. Yeah, zoom in all the way.
Okay.
Yeah, get it blur. Okay, step on the focus a little bit. Yeah, go to the other way. Yeah, yeah, that's very good. Perfect. Okay, now you can see it's almost like here's one space is 1 millimeter. This is 5, so this is 10. So it's kind of almost like 1 centimeter. Now it's 24 times. Now the field, the diameter of the field is kind of 1 centimeter. Let's take a look at the depth. See how much depth we can see.
Like maybe not even 5, 2 or 3.
Yeah, maybe just like 2 millimeter. Yeah, okay, yeah, write down. Yeah, let's think about that. Imagine there's a space. When it at 4 times, this space is like 6 centimeter wide and 2 centimeter high. This is the space we can do microsurgery. But when it's going to 24 times, this space is going down to 1 centimeter wide and 2 millimeter high. That's the space we can do micro.
Yeah.
Out of that, we cannot see clear. So that means when it goes to the 24 times, it's really hard
Yes.
because it's not only the good thing is we can see things bigger, but we only can see so minimum space. So it's hard not only for the eyes, also for our hands. Yeah, because once our 2 millimeter, it's hard to do. Yeah. Mm. Yeah. So in the microsurgery, uh, the good strategy is we want to use the lowest power. We can see clear to do microsurgery, so we can see a bigger field instead of going to higher power to see things bigger.
Okay.
Yeah. Mm. Okay, now zoom out the microscope again. Yeah, zoom it out all the way. Okay, then zoom in the microscope again. Yeah. Hey, Kenzie, do you see?
Yeah.
This time, when no matter we zoom in and zoom out, the microscope stay in focus.
Yeah, I noticed.
Yeah. But at the beginning, when we zoom in and then it out of focus,
Yeah.
right? So what happened?
Did we? Oh, we set it to. It was at first at neutral, and now we've set it to the proper focal length. Is that what happened? Or no?
Yeah. Now I want to talk about the depths.
Okay.
The depths. I think remember the depths. Yeah. Yeah. Zoom in the zoom out the microscope. Yeah. So remember the depths at the beginning when we see the depth at 4 times, the depth is like 2 centimeter.
Right.
So that means when we can see the paper clear, this paper maybe in here or here, when it within this 2 centimeter, we can see the paper clear, right? And then when we zoom in the microscope, the depth it become smaller to 2 millimeter. So if the paper in here and here, it will fall out of focus.
Oh yeah.
And then we're getting blurred. Only when it's when we are very lucky, the paper is within this here, we can stay in focus. But it's not. And then when we zoom in all the way, and then we refocus the microscope, that means this paper is in here.
Okay.
And then when we zoom out, the depth become bigger.
Yeah.
The bigger depth will definitely including this small depth inside.
Okay.
Yeah, that means that's why when we focus the microscope on a higher power, it stay in focus when we zoom out.
Yeah.
Because the depth become bigger, including this small depth inside.
Exactly.
Yeah. So that suggests in the microsurgery, when we set up the microscope, we should set up the microscope in higher or lower power.
You start with higher power.
Yeah. We should set up the microscope in higher power and then go to the appropriate power to do microsurgery. And then, for example, the finger representation, we may the nerve we may use 6, the artery we may use 7, then we goes to the vein we may go to 8. So we may set up the microscope like at 10 or 16, and then we zoom out to the appropriate power to do different things. So we don't have to adjust the microscope. That will be more convenient. Okay, that's the practical part of how we use the depths.
Nice.
Yeah. Okay, that's the microscope.
Wow.
Yeah.
Cool.
So you know when you go to the OR, yeah, you know where we should start, like the eyepiece, match our eye, and then set up the microscope, and then go to higher power, make it focus. At the beginning, it's the rock focus, and then use the fine control, then you can see clear. In the situation we cannot see clear, then we can use this secret diopter to adjust it to correct the difference between you and your teacher or your student. Sometimes it's not right and wrong because our eye also change. Yeah, it's not every day the same.
Exactly.
So sometimes there will be some difference, even we wearing glasses or wearing contact. Yeah.
Okay.
Yeah, that will save kind of save your day, because if you cannot see clear, you not it's not kind of you can do or not. It's also a safety concern, because the vessel, if you clamp on, pick it up in the wrong way, it's hard.
Yeah.
Yeah, it may cause some damage. Okay, now we talk about the instruments. Any question about that? Thanks.
No, it makes sense, I think.
Yeah.
Yeah.
I think you remember more. I think you know some. Still have some memory about that.
A little bit. Yeah. A little.
Yeah. Okay, now we talk about the instruments. So instrument, like instrument, microsurgery, there's only, you can see there's only 4 instruments. Needle holder, this is the needle holder. And forceps, and scissor, and dilator. So that's only 4 instruments. But there's only a lot of difference. Like the needle holder, now we can see this is all needle holder. Yeah. And this is all needle holder. So okay. Now, yeah, Kenzie, tell me what you see. These needle holders.
I see there's a difference in the kind of the maybe how fine the tips are.
Yeah, the tip. Yeah, the fine of the tip size. Yeah, we said the tip size.
Yeah.
Yeah.
Also, I guess maybe the length of the, I don't know if you call it a handle.
Yeah,
where
the lens. Yeah, put a tip on the microscope so you can see a little bit better.
Oh yeah, you can see it a lot better now.
Yeah. So yeah, now you can see the tips. Yeah. So now this tip is thinner. This tip is very sharp. And this tip is pretty strong, right? And this tip is thicker. This tip is thicker. Yeah. And then what difference? What other things you see?
I don't know if it's just my eyes.
Yeah, the
but
lens.
maybe
Yeah, the lens, and then the color.
the color, of course.
Yeah, color like this is a rainbow. Rainbow one is the super fast for super microsurgery,
Oh, I see.
and now it's the most expensive one. Oh, this one is 1,500.
That one?
Yeah, and then you can see this blue one. You can feel it. Now this is a little bit lighter than this. This the stainless steel.
Oh yeah.
This the titanium. Yeah, and then you can see the handle. And the handle is different. Yeah.
Or ridges.
Yeah, this is flat handle. This is the round handle.
Hmm.
So the flat handle and round handle. Flat handle is a little bit more stable. You can hold it. The round handle is a good feature. So you can turn the needle holder easier.
Okay.
Like this one. For this one, if to turning it, it's a little bit hard. Sometimes you need to turn your hand.
Okay.
Yeah, and then here, a small diff. This is a locking needle holder.
Oh.
Yeah, you can try under the microscope and see how it lock and unlock.
Oh, cool.
Yeah, see, there's a hook. Once you reach it, and then it lock. And pull beyond it, and then we will unlock. Yeah, so that's the lock and unlock mechanism. Yeah. So the locking is good. Something good of the locking is you can put the needle here, and then you can let it go and sitting there. it still can holding the needle like a regular needle holder.
True.
The bad thing is when we are using it, once we lock it, we have to unlock it to release the needle. So something good, something bad. I don't like the locking needle holder because it's not so freely.
Yeah.
But sometimes we use it in the super microsurgery, or we want to kind of be holding the needle and then set it on the side, and then you won't lose the needle. That's something good of that. Yeah, so this is the needle holder. Like this one is the standard needle holder for the plastic surgery. So we use difference. Like the hand surgery, it's a little bit finer. Plastic surgery is kind of a little bit stronger.
Oh, I see.
Yeah, and when we go to the super microsurgery, the tip is even finer.
Yeah.
So, and if you go to the transplant, the instrument will be long. Cardiovascular surgery, they are even bigger.
Oh yeah.
Yeah, and neurosurgery, they also has their special instruments. Yeah.
Oh.
And the most important thing is the tip. Like flat handle, I thought of Paul they like flat handle a lot.
Oh.
And I like the round handle a little more than the flat handle. At the beginning, I thought it's because of the personal preference, but actually, I slowly realized it's because of the different surgery we do. I thought they do a lot of flap like the DIP, and the DIP is a big piece of fat tissue.
Right.
So their glove is really slippery and greasy.
Oh.
So if the round handle is very kind of hard to kind of keep it. And for me, like the round flat hand surgery, yeah, our glove usually is just a plastic glove. So we want to get the advantage of this one. We can rotate easier, more convenient. So I think there are two reasons. One is personal preference, and one is the different surgeries we do. Yeah. Take a look up here. There's some information I would like to tell you. Right here, you can see inside there's stainless steel Germany, and here S&T and C14. So S&T is a company's S&T from Germany, and this C is curved. Now you see the needle holder, it's a curved needle holder. And 14, the 14 centimeter long of the needle holder. And like this one, you can see this is the rainbow from the Army factory. And the length is 15 centimeter long, and round handle. And here from the round handle, curved needle holder, 0.1 tip. The tip is 0.1. So when we set it standard, we refer to the tip is 0.3, 0.3 milliliter. When like this is super fine, the tip is like 0.1. I think the concept is a little bit different. This one is like this one is the 0.1 tip is kind of the arm, thin of the arm, and here still not like 0.1 like that. So there are different concepts, but this one you can see it's thinner and a little bit longer. So the thinner instrument is kind of narrower tip. It occupies the less length of the needle. I think about this one is about 0.4, right? If you're holding the needle and then the needle is, some of the needle is just like the 11 suture, it's on a needle length is 3.8 milliliter. So we want to just hold a little bit of the needle instead of holding a big chunk of the needle.
Right.
Yeah, it's hard to use.
Okay.
Yeah. The finer is more expensive. Yeah, like this one is about like 0.2, right? Yeah, so this is also a standard one. It's like 0.3. Yeah. Yeah, so this is the needle holder, and then the scissor. Right. Scissor. You can see. Yeah. So this is the standard set of the scissor.
Okay.
So you can see this is a little bit bigger. This one is for the hand surgery. And there's something even smaller is the super fine needle scissor.
Oh.
And then also this, you can see what difference do you see?
Some of them are flat, like this one's flat, these two are curved.
Yeah. Now this is straight
Yeah.
scissor. This is curved scissor. Curved scissor. Yeah. And then the length is different. Like this is about 18 centimeter long. This is about 14, 15. And then we can see the blade is also different.
Yeah.
So like this one is under the microscope, it looks like huge.
It
And
does.
this one is smaller. This one is finer. Yeah. So here's so these two is the standard scissor for the plastic surgery, plastic reconstruction surgery. You can see the blade from this joint to the tip is like 2 centimeter long blade. This one is about 1.3. Yeah, 1.3 centimeter long. This one is about 1 centimeter long. The shorter is finer. So here's some number I want to have. This is scissor, dissection, curve, 15 centimeter long. So this is curved needle holder. So usually we will use the curved needle scissor. We use the curved scissor for the dissection. Like in the general surgery or the regular dissection, we use the curved scissor a lot. And the straight scissor only when we use it for a straight cut. So dissection, that's why they name the curved scissor as a dissection scissor. So this is a straight needle scissor. So MI is the company. Scissor, adventitia, straight, 15 centimeter long. Scissor, adventitia, straight, 15. So adventitia, why you named it straight as an adventitia scissor? So when you go to the textbook, when the textbook talking about how to trim the clean adventitia, the textbook is kind of looking like this. You can pull the adventitia away from the edge, holding this one, and then you can use a scissor to do a straight cut. Do a straight cut and then clean the adventitia. But that's too good to be true most of the time. Most of the time, we cannot pull the adventitia like this way. We have to trim it all the way like here from the edge and go down to 3 millimeter. Uh, but I think that's why they, because the textbook shows like we can cut the adventitia like this way using a straight scissor. That's why they name a straight scissor as an adventitia scissor. So actually, when we're doing we're trimming adventitia, cleaning the edge of the vessel for the osmosis, we still use the curved scissor. So the straight scissor, we only use it for the kind of cutting make a clean cut or spatulate the edge for the endosmosis.
Okay.
Yeah, and then this is the round handle. Okay, round handle. You can see round handle. Here's some information I would like to show you. This is curved scissor, right? So what's this mean?
Scissors dissecting
curve.
It's 18 centimeters.
Yeah, 18 centimeter long and
round handle.
Yeah.
8
is 8 milliliter of the diameter. So mostly of the round handle is made as this one. Yeah.
Scissors, adventitia, straight, 12 centimeters, and then said round.
Yeah.
7.
Yeah, the diameter is 7. You can feel this one is a little bit smaller. This one is most of the instruments like the 8 centimeter or 8 millimeter diameter.
Yeah. Okay.
Yeah. So this is the scissor. Okay. And now we talk about the forceps. This is different forceps. So what do you see? What difference do you see?
A lot of variation. This one is like the straight end versus this one seems more curved.
Yeah.
The mostly flat handle, but this one is round.
Yeah.
Let's see what else. This one's very flat. I guess it's a super micro.
Yeah.
Almost more flat. This one, the diameter, I feel of the. Actually, no. Like some of them, the width of the actual what should I call it? End of the forceps is like thicker and flatter, it seems.
Yeah.
Yeah. And then obviously the length of the handle too.
Yeah. Yeah. So the round handle is the same idea. Round handle you can turn, you can change. So you turn like if the open is like this way, and you turn the open will become this way. So it's easier to pick up the suture in different orientation. This curved needle hold or curved forceps, angle forceps. So it's good to pass something under the vessel or nerve. This is the straight. Now you can see this one straight is way stronger than this one, right?
Yeah.
So it can use to pick up thicker tissue, and this one is for pick up finer tissue. This is the super fine. You see the tip is way smaller, sharper. Yeah. And this when it's the standard set of this one like this is S&T, ASSI, and they is standard. Standard that means 0.3. Okay, and this is S&T, Jura forceps, angle forceps. It's a long forceps. So 3 millimeter of the tip. Okay, the quality is pretty consistent, pretty good. This is 0.3. See.
Oh yeah.
Yeah. 0.3. Yeah. So S&T have control is pretty good. And this one is this forceps. Let's take a look at this. Jura forceps 3.3. Yeah. So the microsurgery is from the Jura industry. We follow their instrument
Yeah.
to do microsurgery at the beginning.
Wow.
Yeah. Like that's 670 at that time. And then we make it forceps for surgery. Okay. let's take a look at this one. This rainbow one is the superfine. So we can see here's a number is kind of talking about 0.5, 0.05. So this is kind of very sharp. And the lens is 12 centimeter long. Yeah, you can see the. So this one is very easy to got damage. That's 0.1. It's even smaller than 0.1. So think about, you can look at here, you can see the difference. The regular one is like this thick, and when it goes to 0.5, it's half of this one. So this one is very easy to get damage. So in the instruction of using it is kind of even recommend you don't tap on the table, because that 0.05, once you tap on the table, it already damaged.
Yeah.
And that's $200.
Ooh.
Yeah.
Do that.
So yeah, it's very easy to get damage, but and once it damaged, it's hard to repair. So this one is retired from the OR. It got small damage, but we still can sand it down a little bit, and then we can use it in the lab. It's still much better than the regular one. When like yesterday we did a limb transplant. That's the high limb lower leg of our rat. That is tiny little bit like this size. This it's similar to the newborn baby finger.
Wow.
And then we transplant. We put it into a recipient rest ingrown area.
Oh wow.
We bury it, but keep a piece of skin as a window to watch the perfusion. That vessel is kind of less than just like half centimeter at 0.5. And then we have to put 6 stitch there, 6 stitch.
Wow.
So that's, we need so fine needle holder and forceps. This way can allow we pick up the suture. Like it's 0.5. And then if we use 0.3 things to pick up a 0.5, it's hard. And it's even harder to put the forceps inside the lumen to provide some counter pressure to pierce the needle.
Oh, that's cool.
Yeah, so the final instrument now making the microsurgery much better.
Absolutely.
Yeah.
For something like that, do you have to zoom into almost the full?
No,
high power.
At the beginning, everyone said, "Oh, we need to zoom out to 30 times." But in my hand, like yesterday, I may zoom into like 10 or 12. That's already, we can do like 0.5 millimeter vessel and osmosis. I think it depends. When I feel comfortable and that at that situation, sometimes you need to use your skill to kind of compensate the feel of the view. So the kind of the principle is, the rule is use the lower power. We feel comfortable and we can see it clear and to get a job done. High power sometimes you can see things bigger, but it's hard.
Yeah. Okay, that makes sense.
Yeah, I tried when the 0.3 millimeter vessel. 0.3 is like this size of vessel, and then we put 4 or 5 stitch there, and then I test the microscope. What I use is just 12 times the magnification.
Oh wow.
Yeah, I feel when I can see the lumen, then that means I can do the micro.
Okay.
Yeah. Don't have to see the lumen way bigger like that.
Yeah.
Sometimes I don't even want to dilate the vessel, because when we dilate the vessel, it becomes bigger.
True.
That means we need to put more stitch there.
I never thought about that.
I just want to keep it like as kind of regular. I don't want that spasm. Spasm is hard, so I want most of the time I use the dilator, just making it go back to the normal size instead of making it bigger.
Okay.
Yeah, but when it's very small, really small, like 0.3, I would like to making it like bigger, a little bit like 0.5. 0.5 is, even there's 0.2 millimeter difference, it's way easier than the 0.3.
Oh, I bet.
Yeah. Yeah, so this is the last one, dilator. And when you see the dilator is a little bit, you can see the tip is like a taper tip. See that? And you can see the surface of the tip is smooth, right? So because when we use this one, we put inside the lumen, so we want a smooth surface to protect, to prevent cause damage to the intima. Like this one is sharp and rough, comparing to this slightly smooth surface.
Okay.
Right. So this one is for the pickup forceps. This one dilator we put into the lumen and then dilate it to prevent the cause some damage. Yeah. So this is major 4 instrument we will use. And then there's something else like the different forceps, and there's some forceps to holding the clamp. That's different. Like in one pen, you may see 20 instruments there. So the basically is 4 instruments. Yeah, try. Right?
I'll try it.
Yeah, right. Here I found a short, small needle.
Oh, that's a,
See if you can pick up the needle.
I don't know if I can see it.
Right away.
I think it flew away. Is it? Maybe. Oh.
This one is suture is long, very long suture. So the better way to take the needle out is we starting to release the tail first. I think about like the tail is stuck in there. So if we holding the suture, the needle, and then try to unwrapping it, sometimes the suture could cut in the sponge, and then you break the suture right on the needle, and then we lose all the suture. So you can release the suture first when there's nothing stuck in the sponge. Then we release, and then we pick up the needle. This long suture, it's hard to use. Usually the 10 centimeter is the best length to use. The long suture, there are higher risk of we break the suture. Which is not good. Yeah, so this the suture. That. Yeah, you try, and then we talk about the needle, the suture, what kind of suture we use, and what's the that's the forceps.
I remember correctly, kind of pulled this way. This way. Yes. Something like that. Is that typically how you do it?
Yeah, you are correct. You're holding the needle correct. It's like that. The needle, when we're holding the needle, there's different method of holding the needle. Like this forehand, holding like this way, forehand, and then we holding this holding backward is the backhand. Right? So when we stitch and something like this, then we use backhand technique. Sometimes if the needle, the vessel like this in this direction, we have to stitch like this way. So it's hard to do it like this way. So and then we can hold the needle like this way. This way, one of my Japanese friend, he published a small paper. It's like uppercut, uppercut like that. So it depends on the situation. So we usually we holding the needle like this way, and we a little bit pivot a little bit. The idea is making the needle parallel to the vessel, the axis of the vessel. Okay. So for the suture, I in the yeah. Now you know, can make sense of the locking, right?
Yeah.
It's not so free, not so freely. Like sometimes you have to unlock it once it's locked.
Yeah.
So now I would like to talk about the suture.
Okay.
So the suture, when we go to a hospital like here, is already well established. You don't need to worry about what kind of suture we use. But if you are the first one in the OR and then they said, "Oh, Kenzie, what kind of suture do you like for flap and something?" You need to tell them because at the beginning I thought the microsuture is all the same, but actually it's not. So for the plastic surgery, we use suture mostly from 8O, 9O, 10O, 11O. Sometimes we use 12O. The problem is there's different needle on the same suture. Right? And typically, where I realize it and make me think about that is when I starting to teach you guys about the sutures for these two suture. This is an AO suture. I usually like you can write down AO, 10O, 9O, and usually the AO we use on the vessel like 2 or 3 millimeter above. And 9O we use 2 to 3, and then we use 9O. And when it's between 1 to 2, we use 10O. And then when it's sub millimeter, we use 11O. 10O we use 1 to 2. Yeah. 1 millimeter we use 11O. When it's smaller than 0.5, remember I said 0.5 is kind of one before. Bigger than 0.5, I feel is similar to the 1 millimeter vessel. It's not too much different because I still can put 2 arms inside the vessel and I still can see the lumen very easy. But when it's less than 0.5, it's really you need to train your hand to get comfortable to handle that needle in so fine movement. So if we have 12O, I would like to use 12O for this less than 0.5 vessel. And so, and then when a few years ago we did a artery transplant in a monkey, a primate, that's a femoral artery, and they asked us what kind of suture we would like, and I said AO. And then yes, they buy some AO suture, and that's this product. And when I was using it, wow, I feel the needle is too short. The femoral artery is about, in the monkey is about 3.5, 2.8, and 3 millimeter, like that size. And I feel like every time after I do the entry bite, I have to take it out to do the exit bite because the needle is not long enough.
Oh.
Yeah, and then I see, oh, that's not the same thing I use. Then I go back to the lab, I see this product is what we use, and this one is they buy. And you can see here's some information of the suture. This AO is the suture size is 0.4 metric. This is pharmaceutical unit. It's not hard. It's hard to relate to inch or centimeter, millimeter. So AO is 0.4, 9O is 0.3, 10O is 0.2, 11O is 0.1, and 12O is 0.01. So that's the suture. 5-inch long is 13 centimeter long. Here's the needle information. So here's like this is BV is blood vessel, right? 130 is the diameter, 130 micron. And 3 is the category number of the company. 3.8 millimeter. That's the length of the needle. And 3.8 3/8 circumference. So we don't like the half circumference needle. Half circumference needle is hard to use in microsurgery. Like we use it in like the tendon and somewhere else. And taper tip. Taper tip is considered as a traumatic needle. Like when we stitch the skin, we use cutting needle.
Right.
Like sometimes reverse cutting or cutting. Now take a look at this one. Almost the same, but the needle is 5.1 millimeter long. This is very close to the size of the needle. Yeah, see the difference?
Yeah.
Small and long.
Yeah.
And since then, I know the size is different. So guess what kind of suture they put it on a 3.8 millimeter long needle?
Suture? Oh, probably the smaller.
Yeah, it's at the
11
11O suture. So think about it, 11O suture is for the 1 submillimeter vessel. And then the AO is for the 3 millimeter vessel. So they use the same size of the same length of the needle, making it very hard to use. And I think it's not appropriate, a right product.
Oh.
The company they just, okay, I have this kind of needle, I have this kind of suture, let's mix it together.
Exactly.
Yeah, this one is not a right product.
Oh, okay.
Yeah, so you can see like this is AO, this is a 9O, this is the 5. You see the 5 millimeter, 5.1, and the diameter is 100 micron. So this is a good product. Yeah. And then you can see they also put it on this needle also. 130 micron thicker, the shorter needle, so it's hard to use.
Yeah.
Yeah, and then like this one. This one is even VAS, I think, vascular. Maybe. See the needle?
Yeah.
It's not good for the vessel.
No.
I think about you pierce the vessel, and then you pull it through, and then there will be like this traumatic hole in there, and then your suture is a 9O rounded suture. You cannot block the hole. And then like this is the 10O, they put it on this same needle, 130 micron, 3.8. That's the same size of the AO suture. But the 11O, you can see 11O is the diameter of the needle is 50 micron. That's way smaller than the 130 micron.
Okay.
Like this. This is 130 micron. So it's almost 1/3 of this one. And half of the 9O, the 9O is 100 micron. Yeah, so it's half of the size of that. Here, there's different, see, see this size of this shape of the
Yeah.
needle. So take a look at what kind of atomic
Oh,
atomic needle. So it's for stitching the eye.
oh.
So at the beginning, I thought, I don't know why they make it so weird shape of that.
Yeah.
And one of the my friend of the atomic survey, they said the eye tissue is really different from the vessel. Very tough and sticky.
Oh.
And when we want to pierce it, you need to really hard to pierce the kind of stitch on the eye. So they want to hold it more steady because this is a round body, it's hard. So they usually make it like a flat body. And for the eye, they don't want to pierce the full thickness because the eye inside is liquid. If you take a full thickness by, there will be a leaking.
Yeah.
And there also a higher risk of the bacteria going into the eye. So they designed this needle is for holding it better and can take a partial bite.
Okay.
Yeah.
So like is it usually like the cornea or?
Yeah.
Oh, okay.
Yeah, cornea. Yeah, and even sometimes inside the eye, this is a microsuture is absorbable.
Okay.
So you don't need to remove the stitch. Yeah, like this is AO. This AO is a double arm AO. See that? So the double arm AO is for when the cardiovascular surgery, they run the suture all the way from here to the top to the other side and then tie it down there. And sometimes they move a long way like this.
Yes.
So you can see that the suture is 60 centimeter long, 24 inch. So the micro for surgery is only like 5 inch.
Oh, wow.
Under the microscope, we cannot move. We hate to move so far. Yeah, after I got that wrong suture, and then I realized, yeah, we should take a look at that.
Yeah, look at it closely.
Yeah, and then as we use a lot of suture, and then we kind of making it like a library. But this is a 12O. 12O, this is the 0.1 metric. The 11O is the 0.1 metric, so it's 10 times smaller. The needle is 2 millimeter long and 50 micron. Diameter is a taper tip, and then also 3/8 circumference. Let's see if there's a needle inside. Yeah, so you can see. Yeah, so this is 5.1 millimeter, 10O, 9O suture. So this is a 2 millimeter 12O suture. This one is a little bit damaged. Yeah, bend the tip a little bit. Yeah, so this is the 12O. This is the 9O. You can see the difference under the microscope.
Cool.
This is 11O. See, the 11O here is 65 micron, 3 millimeter long. This product is from Japan, Guangzhou. So you can see this one is a little bit slightly longer than that 2 millimeter needle, right? A little bit bigger, 50 micron and 65 micron. The suture size is similar by watching separately. Try to pick up the. Yeah, try to pick up this one. Yeah, 2 millimeter needle.
With the
Use this.
The regular one, or?
This one. The super. This one.
gonna be difficult. So we kind of do that. It's pretty difficult.
Yeah, I think about this needle. If we like this needle holder, it's already feels big, right?
Yeah, it does.
So if we want to be comparing this needle holder, so it's almost take all the
Yeah,
whole needle.
it does.
Yeah.
It's hard to even grab
Yeah.
the suture
Yeah,
itself.
like this one, this needle holder, like we still can occupy a part of that, but we still can use it.
So just kind of grab it this way.
Yeah.
Oh,
Okay. Yeah. Any question about the suture?
I think I had one and I forgot.
No worry, no worry.
It'll come to me.
Now is the question, it may not be the question later.
Yeah.
Okay, now let's practice some stitching. Now we already see what's the good way to hold the needle. So mostly stitch like this way, take it out, and pull it all the way by one hand. I like to do that. Nuts. Tie knots, there are several different methods. So we will see, you can see this is tip is bent a little bit.
Oh yeah.
So making it cannot catch the suture. Yeah, too bad. Yeah. Yeah, so it's tiny damage and then
It's a big.
yeah. And like this, you can see the tip is long, so you can touch one segment on the tip. So it's better to handling the suture.
Oh.
Yeah, like this one, you can see, like this one is only touch on the tip. We have to squeeze a lot to touch.
Yeah.
So if we want to pick up the suture, we have to go to the very tip. If we're holding here, we need to squeeze a lot to catch it. So that's some slightly different. So although some of the instrument you see looks like the same, but actually it's not.
Right.
Like this one is, see, it's hard to catch the suture. The suture is always go away. See? All right.
Yeah.
Okay. Yeah, you try one, and then let's see how much you still remember, and then we start from there.
Okay.
And no worry. your first time.
No, it's first time in a long
Yeah,
time.
you can use this. Try this one. Yeah, try different one. That's the titanium instrument. Yeah, try this long handle instrument.
Okay. Um, so then, okay, so
Yeah, holding the yeah.
somewhere or further back.
Yeah. I can hold in the needle holder using a whole needle holder catch the suture. Yeah, needle holder. Yeah, and make loops on here. Yeah, just see. Yeah, this
Oh,
way.
there it is.
This way. Yeah. Move the microscope a little bit so the suture can stay in the middle.
It's not that tight.
Yeah.
So then it's like you switch.
Oh, yes, you still remember
I
that?
remember that, but I don't
Yeah,
remember
yeah.
how to do it.
Yeah. So yeah, let me explain a little bit like that. So the stitching method that's like at the beginning now you feel, oh, I have to think about how to cross the instrument.
Yeah.
And why we pass the suture. Pass the suture is kind of, this one can help us just do it without thinking.
Yeah.
Like just point left to right. Like if I didn't pass the suture, and then I have to kind of like cross the instrument
Yeah.
or think about it, oh, which way to go. Like this is one of the problem. So I pass the suture, and then every time after I tie the regular thread knot, pass the suture, and this way allow us just always pulling the suture left to right. So we don't need to use our braid.
Yeah, exactly.
Our braid is yeah,
Thinking
the
of-
braid is only just want to have fun.
Exactly.
Like just like to watch movie, music. They don't want to do step one every year.
No.
Yeah. So this is one of the method I in our teaching. The reason I teach I teach a resident at the beginning do this one is it reduce the difficulty, so have more fun.
Mm-hmm.
And the second one is in one lecture the professor teach us is kind of, okay, you do it like the same way like we do it in the regular stitching.
Mm-hmm.
Like the regular stitching,
Mm-hmm.
what we do is we stitch it, and then we take it out, and then we use a needle holder,
Yeah.
and then to start to tie knots. And then always make loops on the needle holder.
Yeah.
And then we cross the instrument to tie a square knot.
Mm-hmm.
So the professor, his idea is kind of it's good because we can translate what we know in the general practice. But then we have to cross the instrument and to test them out. We are not. But when it goes to the microsurgery, it's a little bit hard to kind of cross the instrument. Yeah. And then actually at the beginning, when we feel it's hard, at the beginning it's hard, and then slowly we're getting better. I'm getting better, but I don't know what has been changed. Until I teach, and then I see, I can, sometimes I switch the suture to make it easier. And both of my hand can tie knots. I can use left hand and right hand. And then I remember, I record in one of the practice, I see my teacher, he passed the suture, and he may not realize what that's something good, or and then I look, oh, it's cool, and then I doing the same thing. And then it become kind of making me later I realize that's a good way to for the beginner. You don't need to think, and then we can avoid crossing the instrument. And something even better is we can train both of our hands to improve our hand dexterity. So at the beginning, I would like to kind of encourage you to use pass the suture and then practice both hands.
I like that.
And then when you're getting better, we switch to other different methods.
Okay.
Yeah, I will show you the other methods. So we have the whole picture, and then we can understand why use this method and what's the good thing and what's the bad. You know there's airborne suture. You may hear that.
I've seen you do it once.
So like this one is like the needle. When we pick up the needle, see I turn the needle holder a little bit. Because if we still holding the needle holder like this way, before we can close the needle holder, one arm already hit it away. So I turn the needle holder, match the curve of the needle. So it's easier. So I starting by the needle holder. So the first one really would like to use a surgeon's knot. Then I pass. If I didn't pass, I didn't really cross the instrument. So actually you will see the teacher they pulling it up and down instead of completely cross. So this is one of the alternative method. And then the third one is still pull to left to right. Only the middle one, they switch to up and down like that. See? So this is the most common thing you can see in OR. They switch to up and down at the one of the knot. So every time we come back to here, instead of stay here to make loops here and then move to here. While we're moving, sometimes we lose the loop. So we go to in front of you, and also on above of the suture. So we make loop and then we catch it. Go here, make loop and catch. When we make loop, this instrument is always in between these two sutures. I'm not stay away. Like this is stay away of two sutures. So I make loops, and then I go here, far. Right? Right here. I put the instrument here, and then it's kind of making a loop like this. So when you getting better, then the airborne method. Airborne method is kind of we control the short end. This will control the short end. Sometimes it's hard. Sometimes it's still drum away. Catch the suture. And in some ways, special situation is like we walking in a deep space. If we lose the short end, if you're hiding behind somewhere and then you don't have a good assistant to help you to pick it up. So this one is we 100% control both of our long end and short end. Yeah, so this is four of the major technique we learn and teach here. And most of the time we can use the second method and the third method, the airborne method. Once you got it, as the senior resident they said, when they just got this one at PGY 2 or 3, it will become their only method.
Really?
Yeah, because you naturally just use this way. It's fun. Okay, how you try?
Okay.
Yeah, yeah, nice. Yeah, left to right. Yeah. Okay, can pass the switcher.
This. Oh, this is the one.
Yeah, you
Let
try
me
this
do easy
later.
one.
Yeah, that one is hard to pick up the switcher.
This. Oh, yeah, this is much easier.
Yeah, good. Yeah.
Yeah, see, yeah, that is easier.
Yeah. Good.
And then pass this here.
Yeah.
Yeah, it is fun. Oh, yeah.
Look at me. A little bit more.
Okay.
Yeah.
It's running away from me.
Yep.
It's a few. Actually, so when you're doing vessels, how many knots do you typically?
Oh, 3 knots.
3?
Yeah, 1 surface knot and then two more.
Okay.
That's pretty enough. Yeah, okay, that's pretty much today.
Yay.
It's almost 2 hours.
Exactly.
So, but we didn't feel that's 2 hours.
I know it flew by.
Yeah. Oh, one thing I want to talk about is why we pass the suture. Like, okay, like we hand tie the knot, right? Okay.
Yeah.
You hand tie knot. You remember how to do that?
It's been a while. Oh wait, let me do this one.
And what's
Maybe
what's the needle, huh? Yeah, the needle is.
not to stab myself.
Yeah. Yeah. Okay. Now, hand tying knots is very fun at the beginning. Like especially when we just learn it, we tie knots everywhere, like the water bottle,
Yeah.
the door knot, and the pole of the bed, and so when we tie knots, usually we hold them like this way in the medical school. Then we tie knots like cloths and then like this, and then we kind of tie a square knot like that. This is what we learned in when we was a medical school student. But then when we go to the OR, we see the teacher, they didn't hold the suture like this way. They cross the suture at the beginning.
Yeah.
So they tie knots, at the beginning, the first knot, they don't cross the suture actually. So think about, they cross the suture. Naturally, I see that, but they didn't tell us in medical school.
Yeah.
And this is the same idea of we cross the suture. Instead of we still holding, like we pull the suture out, we still using the needle holder to holding the long end. We make loops on the needle holder. Like we regularly use the microsuegery. We cross the needle, the suture, we holding the needle holder, and then we loops on the forceps. So we cross the suture, so to avoid we have to cross our instrument. So it's the same idea, but at the beginning we don't know.
Yeah.
Until we practice and naturally change.
Yeah.
And then when we're getting better, we feel it's not less struggle, but we don't know what has been changed.
Yeah.
That's me. And I didn't realize that change until I teach the Western. I see they have some struggle here, and then I comparing to what I was doing. Oh, I switched the suture actually, and then it changed. When I record it, it's way go back to at the beginning of my Western. When I was struggle and then slowly getting better, and then the better is what's the change is these small things.
Yeah. Just all those things matter.
Yeah. Okay. Yeah,
That's it.
summarize. Let's go. Okay. There's a filter, so making my face look younger.
Me too.
Okay, now everyone, now it's 2 hours. Actually, we feel it's so much fun. So every time, I didn't feel like that's 2 hours.
Yeah.
What do you feel? How long do you feel?
It feels like 30 minutes, maybe.
Yeah, 30 minutes. I remember when I was going to a karate class. After 30 minutes, the lesson is like 45 minutes. After 30 minutes, I keep watching the clock. Oh, there's still 15 minutes.
Exactly. I know.
The microsurgery, it didn't like that. It didn't feel like that.
Yeah.
And that means you really enjoy and you like microsurgery.
Yeah, it's fun.
Yeah.
It's fun when you finally realize, like when I was tying the knots and I got the hang of it, that's when it becomes really fun.
I can also see the difference of your this time and when you was a medical student. Yeah, the general practice also contribute to the microsurgery. yeah, and more confident. At that time, it's yeah, pretty green.
Yeah, we don't
Still
know
new
anything.
student. Um, yeah, yeah. Tell our audience kind of what things do you feel is very helpful today.
I think honestly, even getting the kind of the foundations of the microscope itself was important because
Mm,
I think one day I'm gonna be the resident who goes in and make sure the
Mm.
microscope is set up right and everything. And
Yeah.
if I don't know where to start, like I might be doing it in the wrong direction, and I think that would be a source of anxiety for me. So knowing the how it actually works from
How it actually
yeah,
works. Yeah.
at a fundamental level, I think was important. Yeah.
Yeah. And yeah, the microscope. Yeah. And instrument and suture. Yeah.
Yeah.
What do you, like? What comes to your mind? Like feeling, oh, yeah, it's very helpful now.
I also think, I guess now I know, depending on like the certain case, that there, like, I don't think I even realized there was so much variation in the types of,
Yeah, the variation of the instruments.
yeah. So I think now, if a scrub nurse or tech asks me, oh, which kind of forceps do we use or something, now I at least have some understanding of, okay, what the letters mean and why I would use, a finer tip versus another type, something like that.
Yeah.
So that helped. And then even for the suture, I don't think I ever thought about what type of needle we would use, but it makes sense. You would want the taper one because you
Yeah,
don't want
I don't know
slice
that
through.
until I meet some problem.
Yeah.
Oh, I don't know that.
Yeah. So now I can avoid the problems, hopefully, because I know.
Yeah. Yeah, cool. And then we practice a little bit the knot tying method and handling the suture. Next lesson, we will kind of focus on handling the suture and tying knots. Yeah, the more kind of there's different technique. Different teachers, you will see different technique. But in the lab, we practice kind of everything, and we know the basic mechanism of why. So when we know why, and then you will know better how to do it.
Right.
And in the OR, you may see, oh, this technique, this part is better, and I would like to use it. And the other part is, I have better option.
Yeah.
So you pick all the better things, and then making you the best and better than us, better than the teacher.
I don't know. I don't know if that's possible.
Yeah, yeah, it's possible. Everything is possible. Okay. Yeah. Okay, everyone. If you like microsurgery, and if you feel helpful, yeah, please leave a comment there and let us know your country, your hospital, and your the difficulty in your area. Yeah, and we go overseas to teach micro course. Like we go to Vietnam this year, last a couple months. We go to South Africa, go to Egypt, Rwanda, and yeah, several different countries and in Asia and Africa. So yeah, we may go to your hospital. Yeah. Please reach out to us and please hit the like button, subscribe, and share. Bye.